Good day, sir. I am Aira Lopez of BSN 13, and today I will be performing the return demonstration for administration of Buccal medication. The purpose is to provide the medication that has a systemic or local effect in the buccal route. So for the assessment, we must assess for the following such as the level of consciousness and ability of the client to understand instructions, as also the client's vital sign. If the patient has nausea or vomiting, recent diagnostic and or surgical procedure, history of allergic reaction to certain medication, if the medication has an unpleasant odor, the expiration date of the medication, color and appearance of the medication, as well as the intactness of the wrapper. For the planning, we have to observe the 12 rights on giving medication such as the right patient, right drug, right dose, right route, right time, right documentation, right assessment, right evaluation, right drug presentation, right motivation and approach, right to refuse, and right of the client to know the reason of the drug to be administered. And then we also have to perform hand washing before and after the preparation. For the materials, we have to prepare the following such as the hypotray with lining, the prescribed medication by the attending physician, the medication card, and the medication glass. So moving on now with the implementation or the procedure. So first we have to perform hand hygiene and put on PPE if indicated. And then identify the client, introduce ourselves, and explain to the client or relatives the procedure as well as the action of the drug. So doing this process will ensure that we are giving the right medication to the right client. So good day po ma'am. Ano pong pangalan niyo at birthday?
Yana Lopez, September 27.
Okay po ma'am, thank you. So ma'am, ngayon po, ibibigay ko po yung medication na order nito sa chicks po ninyo. Okay po ma'am?
Okay.
Thank you po. So after that, place the hypotray on the bedside table and provide client safety, privacy, and comfort. So we have important reminders upon providing those such as proper positioning based on the procedure. Also by putting down the side rail on the side that we will work on while keeping the other side rail up. Also spreading the curtain or closing the door during and after the procedure. And also by placing the call light within the client's reach. So now assist we will put down the side rail on the side that we will work on and assist our client into a sitting position, if not possible in a side-lying position to prevent aspiration. Ma'am, okay lang po ba kayo sa pwesto po ninyo?
Okay lang.
Thank you po, ma'am. So, first we have to put on clean gloves. And then, unwrap the medication and ask the client to open her mouth. Then, place the medication into the buccal pouch, which is between the cheeks and the gums. Ma'am, open lang po ang bibig. Sara na po. So, after that, we must instruct our client to avoid opening the mouth, talking, eating, moving, or standing, to ensure that the medication will stay in place and it will not move, and also to allow for the medication to be dissolved completely and be absorbed for at least 10 minutes. And then we will assist our patient into a comfortable position with raised side rails, and then dispose all used materials properly and rearrange the reusable ones. And then we will remove PPE if used and perform hand hygiene. And then after that, we will assess for the effectiveness of the medication given, document the administration of medication onto the client's chart immediately, including the client's reaction to the medication after administration. And then lastly, evaluate for the client's response to medication within appropriate time frame.